diagnosed with stage 4 throat cancer caused by HPV, the human papillomavirus, back in 2013, I was just flabbergasted. I was flabbergasted because I was a non-drinker and a non-smoker of many decades, and I didn't know the HPV virus could cause throat cancer. But also, I just felt so well. I just had a persistent cough and a couple of lumps on my neck and an earache, but it never occurred to me that I had cancer. And that shock immediately affected my cognitive capacity. When they told me I was going to be treated with 33 sessions of radiotherapy and weekly chemo, I knew nothing about what to expect. I had never thought about radiotherapy. I had never seen a bunker where the therapy is delivered. I didn't know that because it was a head and neck cancer and the radiation was going to be coming into all this area, my throat and this area, that I would have to wear a personalized mesh mask to keep me still for safety reasons. And that was very hard for me when I experienced it for the first time. But even those complexities weren't on my mind. I was so shocked that I had to have radiotherapy. I didn't even know what questions to ask. But most importantly, I even forgot to ask, would it hurt? So I could sum up by saying that when I was diagnosed, I was totally ignorant and full of fear. When I look back on my radiotherapy experience and think of someone who's just been diagnosed and who's approaching it for the first time, I would really like them to know that it doesn't hurt, that you don't feel anything while it's happening. And secondly, I would like them to know that it would be a very good idea to ask your radiation oncologist or a member of the multidisciplinary team, so that's nurses and other people who help us with treatment and recovery. Let them know that you'd like to see a picture of what the LINAC or radiation therapy machine looks like, where you're going to be positioned on that machine. I was lying flat. And is there anyone who's had the treatment that is the treatment you're going to have whom you could speak to, or at least see stories that have been written by patients who've been treated for the same cancer with radiotherapy? I just think it would have helped me so much if I just knew more about it before that first day that I went in for treatment. And most importantly, that I could have seen pictures or diagrams, or even better, gone on a tour of a radiation therapy room or bunker and actually seen the technology. I just think I would have been less anxious. And I think I also would have asked for some help to handle it, like listening to music, like having someone hold my hand while I was got into position, like some mild sedation, which I ultimately got to help me. It's been really important to me all along to share my story of my treatment, my diagnosis, my treatment, and my recovery to whoever will listen, to be perfectly honest. My first desire was to tell fellow patients, and I was interviewed by a radiation oncologist. My answers to her questions were recorded, and those videos have been shared by doctors and other cancer team members to thousands of people who've been diagnosed with a head and neck cancer. And I'm just so grateful that clinicians have seen the value of sharing a patient's story. I think there's no substitute for a patient who's about to have radiotherapy to hear the story of a fellow patient, not only just describe what the treatment's like and the recovery's like, but just to see a patient who's survived cancer. Because I think so many of us, when we get that cancer diagnosis, we're just full of anxiety and fear. And there's nothing as reassuring as seeing a patient who's gone through it and come out the other side. But I also think it's good for cancer team members to see these videos because it exposes them to the emotional and psychological impact of a cancer diagnosis and the treatment. And if they can hear the patient's story, empathise, understand emotionally, feel some of those feelings, I think they're much more likely to do research and make an effort to help us psychologically, which I think is as important as survival. I think in all health situations, but even outside of health, in all major life experiences, personal storytelling is the most powerful way to communicate experience and information. A person talking one-on-one with eye contact directly to you about what happened, what it was like, and how they are now is the absolute bedrock of the self-help movement in a whole range of health areas. And so I just think there's nothing more valuable than personal stories. And I would urge you, if you have had a cancer experience, a cancer diagnosis, and you have been treated with radiotherapy, and you're willing to share it with other people, take the opportunity to have your story recorded by one of the nurses or a fellow patient and get it out there on social media, or take the opportunity, if you're asked to talk at a conference or to talk to a patient support group, go and share your story and answer people's questions. It makes you feel better to feel that your suffering has meaning and purpose because it's been useful to someone else. And it has helped me to overcome the trauma of the experience. If you've been treated with radiotherapy and it's improved your life or saved your life, and you've never shared your story, I want to encourage you to give it a go and share your story. Help raise awareness for World Radiotherapy Awareness Day, because heaps of people with cancer don't have access to radiotherapy, and we need to motivate cancer care centres to get their act together, apply for funding, get the funding, and get the latest technology that offers radiotherapy available at their cancer centre, because it can save lives. It saved mine. I could have had surgery, but radiotherapy worked for me, and I don't have any scarring. And I work publicly in a sort of audience-facing job, and I hope people would have hired me even if I was scarred, but they may not have. And I'm just so grateful that I had access to radiotherapy. And also, I think I've been able to influence clinicians in the 13 years that I've been telling my story since I was treated. I think I've been able to influence them to try to help patients who have head and neck cancer, that's what I had, throat cancer, to help us emotionally to handle these masks that we have to wear when we have head and neck cancer treatment. The masks are to keep us safe by keeping us still, but a lot of us have trouble emotionally coping with it. And I think the power of a patient's story can motivate cancer team members to do more of the psychological support front. So anyway, give it a go and tell your story if you feel up to it.